New tonight at 6, the U.S. Senate is poised to vote this week on President Trump's big, beautiful bill. But critics here in Louisiana are concerned about proposed cuts to Medicaid and the SNAP food assistance program.
The bill's Medicaid cuts could lead to 280,000 people in Louisiana losing coverage, while cuts to SNAP funding could impact the 847,000 people in our state who rely on it for food assistance. News 15's Dracar Francois joins us with a closer look at the potential impacts.
Advocates worry that proposed cuts to SNAP could leave thousands on the edge of hunger right here in Acadiana. The Republican congressional plan to cut some of $300 billion in funding over the next decade for the Supplemental Nutrients Assistance Program, SNAP for short, has left Louisiana physicians, food banks, and others concerned.
We know that SNAP alleviates poverty, mitigates chronic disease, and saves healthcare costs in the process. Cutting this program abandons logic, abandons compassion, and abandons a mountain of positive evidence, and is simply bad for Louisiana and the country.
Changes to SNAP will have an effect to Second Harvest in Louisiana annually. The food bank feeds roughly half of poor families across 22 parishes, including all of Acadiana.
So basically you're talking about millions of pounds, millions of meals that we're usually able to hand out right here in Acadiana. We won't have that luxury anymore.
The White House bill also proposes deep cuts to Medicaid, the health insurance program for poor Americans. Senator Bill Cassidy frames those cuts as dealing with fraud in able-bodied people who refuse to work.
Like 1.4 million people who are on Medicaid, who are quote unquote being not on Medicaid, will be those who are here illegally. This bill preserves benefits for those who should be on it, and encourages those who might lose their benefit to kind of do what they need to improve their life.
Some who receive these benefits say otherwise.
I have Medicare, I have Medicaid. If I didn't have those, it would be impossible to get my medicine, get to the doctors, and the ones that we do get SNAPs. We can't live without those SNAPs because of the beneficiary to it, we feed our children. And to cut everything now, it's gonna destroy a lot of people.
Just trying to imagine all these patients, which in our state can total 1.6 million Medicaid recipients, trying to flood the healthcare system with no insurance. The entire financial strain, the implications of that is enormous.
The bill remains in the U.S. Senate as Senator Cassidy and colleagues try to work out a compromise with the House version before it goes back to the U.S. House. The White House wants the bill approved by July the 4th. In Lafayette, I'm Dracar Francois for News 15.